Welcome, my name is Peter Strong and I'm a professional mindfulness therapist and I offer online therapy over Skype. So, how can we overcome anxiety attacks without medication? This is a question that I'm often asked, and basically we have to understand, first of all, what we're talking about when we're referring to an anxiety disorder. So normal anxiety is a natural reaction to changing circumstances, preparing for a test or an exam, changing houses if you're moving, situations like that, changing partners, and so on. These produce a natural kind of anxiety reaction. But the characteristic of what we might call normal anxiety is that it's short-lived. The problem of an anxiety disorder is that it's not short-lived. It persists. It's recurrent. It keeps affecting the quality of our life on a daily basis. It keeps coming back. That is not a normal state of anxiety. It's basically become a self-sustaining habit that recreates itself over and over again when certain triggers are present. For example, driving anxiety. So, chronic driving anxiety or phobia is quite different than the normal kind of anxiety we might experience when traffic gets very heavy or when weather conditions change on the road. So, a driving anxiety disorder is one in which we are propelled into panic attacks, into extreme fear reactions by really quite normal triggers. So in that case, we need to find a way of changing the underlying habit that causes that anxiety. And this we can do through mindfulness therapy and other forms of psychotherapy that address the underlying habit that's causing the anxiety. Medications may have a place in some situations, but it's really important to understand that medications are not going to change that psychological habit. All medications do is relieve symptoms for a while. So if you have persistent anxiety, an anxiety disorder, such as a phobia, or such as OCD, or a panic disorder, or agoraphobia, or any other form of extreme anxiety, then you need to look at the underlying psychological habits. And we can change that really by becoming more conscious of the how the habit works itself. The typical response that we have usually to any kind of unpleasant experience, such as anxiety, is that we run away from it. We try to avoid it. We try to avoid the triggers that produce that anxiety. But this really starts to strengthen that anxiety habit. It means that we become more and more under the control of that habit, and that simply strengthens the habit. So in mindfulness therapy, we recognize this as a primary problem, avoidance and also aversion to unpleasant emotional reactions. That's really what feeds the habit. Instead, we turn consciousness and we develop a friendly relationship with our anxiety. This may seem very strange and it may seem very hard to do, but it's actually not at all. Once you start to actually change the direction of how you are responding to your anxiety, you will learn how to do this. And it needs some guidance. And that's my job as a mindfulness therapist, is to teach you exactly how to do this, how to change the relationship that you have to your anxiety so that it doesn't control you and so that you are not feeding it blindly. We learn to sit with our anxiety in much the same way as we might sit with a friend who is in pain. We learn not to become as upset as our friend, but rather to become a safe and supportive person that's able to provide a space around that anxiety. That's what helps the person overcome their anxiety. If we can provide that protective space. It's very much the same with our emotions. We learn to become friends to our emotions by creating a protective space around them so that the emotions don't ignite further reactivity in the form of reactive thinking and reactive behaviors that feed that anxiety. When you can sit with your anxiety in this way, not reacting to it, then you're creating the ideal conditions in which that anxiety will begin to change itself and begin to heal. And when you're not reacting, then you can actually participate in its healing. You can help it heal itself. So we call this building the alliance between your true self and little self. The little self is the anxiety and other emotional habits that operate blindly out of consciousness, like any habit, to feed that anxiety. The true self is that part of you that can observe the anxiety without reacting. It's what can be present with the anxiety without becoming anxious. So once you get that dynamic between your true self, the observer mind, and the little self, the reactive mind, then you can begin to change those habits. I will teach you how to do this during these online therapy sessions that I offer. So if you'd like to learn how to avoid and overcome anxiety attacks without medication, do please go to my website and then email me to schedule an online therapy session. This approach of using mindfulness is very effective indeed, and most people see significant changes after the first 2 or 3 sessions. So if you'd like to learn more about how to overcome anxiety attacks without medication, please go to my website, learn more, and then email me. And we can start to work on changing these emotional habits. Thank you.